All right, up next, dermatologist Dr. Sandra Lee has the lowdown on the best ways to treat your acne. We'll be right back. I hope it gets home okay. Would you like a little bit of water in there?
From Universal Studios Hollywood, welcome to Home and Family.
Brighten up your day, the Home and Family.
Now, you know, I don't know about you. Did you have acne as a child or as a teenager?
Yes, I did.
Well, you did?
I did.
Did you?
And yes, and you told you what.
Okay, well,
I will tell you, and everybody's going to go, ooh, but I'll just.
Oh, no. Please don't tell the story you told this morning during rehearsal, please.
Okay, I won't.
Oh, my gosh.
Anyway, so I played football in high school. Look, everybody's like,
no.
oh.
Oh, no.
And we would wear our shoulder pads, you know, from playing, and our backs would break out constantly from that. And
back knee.
I'm just saying, we had back knee. And I'm just saying, we help each other out.
You said you guys used to sit there and pop each other's zips on your shoulders. Like, gross.
I just said we help each other out. I tried to dial it back a little bit. I tried to let the
that's so gross.
imagination
Let's
play.
move on.
Just saying.
Okay.
So it is, look, it affects almost all of us at some point in our lives, and here to show us the best treatments on how we can deal with this is dermatologist Dr. Sandra Lee. Welcome back, doctor.
Welcome.
Thank you for having me. Actually, I wanted to say that acne on the back or back knee, I think it's a sign of intelligence. So, you know, you got to think of that, right?
Right.
Well, you're all cleared up now.
But yeah, we're going to talk all about acne. I mean, we all get a pimple sometime in our life, and 90% of the population gets acne. So I'm going to talk about all the things that you can do that are over the counter and really going to the most aggressive kind of treatments to treat the most aggressive kind of acne. Answer all your questions.
And this for adults or for kids or
for both children, because it happens mainly in teenagers, you know.
Sure,
but adult women in particular, we tend to get it for much of our lives, and that's a big complaint that I see in the office every day.
I want to address too. We'll talk about this later on, but I want to talk because growing up, I've always heard, oh, chocolate. If you eat chocolate, you'll break out, or if you have the
pizza,
all about that.
Yeah,
absolutely.
Or In-N-Out burgers. Yum. Okay. So acne is one of the most common skin conditions affecting 90% of us at some point in our lives. And it's not just teen problem anymore. It also hits a lot of adults, women as well. And here with the best ways to beat the breakouts, please welcome back board-certified dermatologist Dr. Sandra Lee.
Welcome, doctor.
Thank you.
So let's causes of acne.
Yes.
I can say it in one word. Hormones. Hormones is really that's the main reason for acne. And you have to, I mean, it makes sense. In puberty, that's when your hormones are raging, right? And actually, the hormones trigger an increase in oil in our skin. This oil mixes with dead skin cells on our skin and kind of blocks our pores. And actually, I have some pictures to show you, because I'm going to show you from the mildest kind of form of acne to the most aggressive form. We have blackheads and whiteheads. They're called comedones, okay? And so, you know, we get a lot of those. They block your pores, and those can turn into active acne. The next step really is bacteria like to thrive in this area, and you get these active red bumps that we all know as acne. You know, they hurt. That is bacteria infecting the area is what's happening. And now the problem is that depending on your genetics or whatnot, you can some people get bad acne. This is actually a mild form of bad acne, cystic acne. And the problem with this is when you really do want to treat it, because there's a risk for permanent scarring. And I tell patients, you know, acne doesn't threaten your life. I mean, it can affect you, and it's really tough because it's during this time in your life where you're learning about yourself. You know, you're a teenager, you're very unsure about the world. But if you get cystic acne like that, it can be in your genes. You know, it can run in families because you have a certain kind of skin type, you have oily complexion, and it's just the hormones that are going crazy. But they can cause permanent scarring.
Yeah, that's what I was going to say, permanent scarring, but I'm going to say emotional scarring as well that can go with it.
Absolutely.
Which, referring more to the teens, because they are going through that time. Is it fair to say, most teens are that's where we see it.
That is predominantly where you see it. But you also, because of those hormones, that's when it's raging. I mean, there's so many times where I'll have an adult mom come in or dad, and they have acne scarring. I can see that they've had acne in the past, and they bring their kids the moment they have acne because they don't want their kids to go through that same thing. I mean, it's devastating, really mentally, you know.
Well, so you talk a lot about hormones, but there are a lot of teenage boys as well who suffer from acne. So
well, it's a hormone. I'm talking about all the hormones in general that are causing everything, that are causing puberty. Those are the ones that are triggering. But in adult women, it also is hormones, but it's a specific kind of hormone. It's androgens. I mean, we all have androgens.
What is an androgen?
It's a it's the hormone that is related to testosterone, that's related to like the female and male hormones, and we all, as women too, have androgens, and that's why we'll notice it in adult women that they tend to get breakouts more during their period because there is more of a surge in it, so it tends to be more cyclical in adult
So
women.
chocolate is a hormone. Is
That could be. Some people might think that, and actually it's funny because a lot of parents will come in and say, you know, can you tell my kid not to eat chocolate or not to eat pizza because, you know, it's making him break out, and I tell them, pizza really only causes you to break out if you rub it all over your face, because it does not actually trigger a breakout. But there are products that you can eat that you want to avoid.
Like what?
Like milk, because it actually has an increase in hormones. It can cause a spike in insulin levels, you know, because of it's from a cow, or it can trigger, you know, there's
How about
hormones.
soy milk?
Right.
Soy milk? 'Cause
No,
that has-
no, not so much, but more like skim milk, as actually, especially of all the, you know, of all the kinds of milk. And also, if you're going to drink or you're going to eat processed food, like very sugary cakes or white bread and things like that, that will actually cause a spike in insulin and also trigger more oil production and then more acne.
Cheese,
Yeah, I mean,
like
all fun stuff, you know,
processed
heavy,
cheese?
yeah,
Okay.
processed cheese.
All
sorry.
right.
So how do we
let's talk
fix-
about our products
how do we-
here.
Let me talk about like the whole range. I mean, you know, so many people that come into my office, they've all already tried Proactive or Stridex or any of these kinds of over-the-counter medications. They're really milder forms of prescription-level products that we'll use. Oftentimes, they're benzoyl peroxide or salicylic acid, resorcinol, and they will work. They work on milder acne.
Well, how would you
know?
rate these? Like, if you were going to...
I'm going to rate from like what you would treat from mildest acne to the most aggressive, to the most you know, devastating kind of acne. So next, when they come to us in our office, we'll oftentimes prescribe a topical product. There are hundreds of them, okay? They're just all different types. But one of the mainstays is tretinoin, which is a vitamin A derivative. It can help block blackheads and whiteheads, which turn into active acne. We also will use some topical antibiotics. We'll use benzoyl peroxide as well because it kind of helps to dry up the skin a little bit, and also it's an antibacterial. You just have to be careful with benzoyl peroxide because it bleaches your towels and your sheets. You know, if you have it on, and it can bleach your clothes. So a lot of parents will notice
Imagine what
that.
it
Like,
does
you
to
don't want to
your
use your nice
face.
towel. Well, it's just, it has a bleaching effect, I think, when you wash it.
Are these a prescription you're talking about?
These are prescription here.
Okay.
These are over the counter. So these are topicals that we will prescribe to patients. And there's all different types, like I said, because you have to really fine tune it for a person. You know, there's people who are oily, there are people who are dry, dark skin, light skin, that sort of thing.
A lot of people use the Proactive.
Yes.
How would you rate this? Really? Seriously?
I mean, it does work. I mean, it is. It's a mild form, essentially,
Okay.
of these.
Of those,
But it's just
okay.
milder, so
Okay.
you might need something stronger.
Okay.
You can't have cystic acne and just treat it with this.
Okay.
That's not going to touch it. So the next step really is to try to get the bacteria, you know, those active red bumps. If somebody comes in with a lot of those, I'll actually prescribe an oral antibiotic, usually in the tetracycline category. And I know a lot of people have problems with that because, you know, you can't be on one forever, and people just worry about taking antibiotics for a longer term. But they can help to get things under control, and then you try to rely on topicals. Lastly there, in terms of medications that we prescribe, is isotretinoin. That is what people know of as Accutane.
Accutane.
Accutane is a remarkable, it really, all these other things do this for acne, and Accutane or isotretinoin does this. It's just that there's a lot of side effects involved with it, and you really have to be monitored carefully. And the whole system is worked out that you are monitored carefully. You cannot slip through the cracks these days.
Well, if you're in childbearing years, you've got to
Right.
be super careful with that.
Yes, that's why we are. That's why we watch so carefully, because we give these to teenagers, right? And so they may tend to be a little more irresponsible about things. And yes, you cannot get pregnant while you're on that medication because your baby could potentially have birth defects.
And you have to
can
wait
get pregnant a month after.
After, yeah.
So it's not like you do this and the rest of your life you can't have a child. So it is a remarkable medication. There's just a lot of hoops you have to jump through. And I wanted to also mention some of the kind of like the cosmetic treatments or the things that you have to pay cash for. Usually insurance doesn't cover it, like chemical peels that can help, and also lasers. I am not a big defender of lasers. I think that they do work, but they're very expensive and they're only temporary. And there are prescription products that can do the same.
Like this?
Lastly,
Here, Mark.
yeah, this
No, I
is
don't
like
need
for
this.
an emergency. This
Nope.
is for emergency pimples.
There-
See?
Come on, you have an
No.
emergency pimple.
You know
This
what?
is actually, this is for when you have a big event, like you have a prom or you have a wedding or your photos
A
taken,
wedding.
and you have a
Gabby's
Mount
wedding's coming up.
Vesuvius
Sit down.
right there smack on your
Yeah.
forehead. You actually come in the office, we inject it, it goes away in a day.
It does?
I don't
Yeah,
want to be
it
the
is
pimple in
actually
your
very
forehead right now, but
remarkable.
we have to jump away
Mark
to
is afraid of snakes and needles.
I know, I'm
For more
sorry.
on Dr. Sandra Lee and all of her information, you can go to her website, which is skinps.com.
What a
Okay.
fun show we had today.
Yeah.
What a great show. It was so much fun. I got to
You having a good
meet
time?
LaToya Jackson. I got to
Yeah.
play in the garage with a little toy, kitchen.
Yes,
Fun.
and we got to talk
And a
about
great
zits.
guest.
We talked about zits.
Zits. We had great
Jill,
guests
you have a
today.
question?
Yes, can you
To the
pop a
first
zit?
Can you?
we've
Well, we know you
all-
can. Should you? Is the question.
Should you
Because
pop
there's
it?
risk of infection, there's risk of scarring, but be smart about it if you're going to do it, because I can't get my hands off my zits either. I know
Yeah.
all
I
of us
did it
can't.
the other day.
Just make
2
sure your
days
hands
ago,
are
right here,
clean.
baby.
That's
No,
it.
when you
Thank
do
you
it,
for sharing.
when you do it for your friends, that's a true friend, and it's a
Yes.
great bonding moment.
That's
Friend?
true.
Nice.
Jesse, yeah, we did it in high school.
All right.
Jesse.
Oh, I have brown spots after being pregnant with my second daughter. I got brown spots.
have
and
that
I get,
too.
Yeah,
They
both
fade.
That's a common
facials,
condition.
like,
Yes.
how do you get rid of them?
It's called cloasma, and it happens after pregnancy, but it also happens in women anytime, really.
Doesn't it
Melasma,
fade, though?
brown
Get rid of
spots.
it.
Sunscreen, very, very
Sunscreen,
important.
you're
Okay,
I'm so
block it from happening.
Jason, can we man up the show? Can you help me out?
Listen,
Anything?
I got permagrin. I'm surrounded by permagrin. This is great. Yeah, invite me anytime.
That's what the show's all about, right there.
We wanted to thank Tracy Metro, Jason Cameron, LaToya Jackson, Jessie
Yay.
Jane, Gabby Kiss, Charlie Boone Temple, Jill Simonian, Tanya Memi, and Dr. Sandra Lee.
Thank you all
so
for
much,
being here.
everybody.
On Monday, we're going to have Real Housewives of Orange County. Gretchen Rossi and her fiance, Slate Smiley, are here. See you then.
Everybody.